In preparing medications, you may be required to reconstitute a medication. Medications stored in powdered form have a much longer shelf life than when they're in solution. The most common medications that you're going to find in needing reconstitution are steroids, antibiotics, and some stomach medications. You need to refer to the MAR or the vial of medication itself to figure out how much solution you need to add to reconstitute the medication. For this medication, we're going to add 5.6 milliliters so that we get a total volume of 6 milliliters of medication to get a concentration of 500 milligrams per milliliter of our Practi medication. So, we need to first clean off the top of the vial with an alcohol wipe for at least 5 seconds, giving good friction. I'm then going to put a needle onto a saline flush, if we can use saline for our reconstitution, and make sure I have the appropriate amount of diluent. So I'm going to have 5.6 milliliters of medication, so I need approximately 5.6 milliliters of fluid in here, so which is about correct. I can go ahead and safely uncap, and then I'm going to insert my needle into the vial and inject the solution. Now I can remove my needle or I can leave it in there, but I need to mix up my medication. So I want to make sure that I have no chunks of medication floating around. It should be nice and clear. So this medication is bright yellow, but it should be clear otherwise with no floaties. Then I can go ahead, now I have a concentration of 500 milligrams per milliliter. If my patient only needed 1,000 milligrams, then I only need 2 milliliters, and I can go ahead and draw that up in my syringe, which won't use the entire volume of the vial. And I'll safely recap, and I'll label my syringe and be able to administer this to the patient. This is one type vial that you might see in reconstituting medications. This is Solumedrol. Solumedrol comes in a very unique vial which has a neck on it. This neck generally has a plunger, which you can see in the bottom. This vial has been used. So you have powdered medication in the bottom, you have a stopper in between, and then in this bubble top up here you have the diluent, the sterile water or normal saline. And what you do is you push the top of this down, that creates pressure that then pops the stopper down into the bottom, and this lets the fluid down to the powder. You mix it up, and then you can draw it up directly from there. The last reconstitution that I want to review with you would be mixing antibiotics for IV administration. A lot of antibiotics are coming in powdered form in vials nowadays, so we have these mini bags that have these little hats on the end. What we do is we peel off the bottom cap. We have to insert the vial on there, making sure that it's all the way on there. Otherwise it may fall off. Then right here is where you're going to break a connection. and then you can squeeze the contents, the fluid from the bag, down into the vial and shake vigorously to reconstitute the medication. The antibiotics that we mix this way are notoriously difficult to get to solution, so you have to shake for quite a while. Once you're done reconstituting and want to get it back into the bag for delivery, you simply flip it upside down so the vial's on top, squeeze air up into the vial, and fluid will come down. Air always wants to go up, so if you want air to go up, then you have the vial up top. If you want fluid to come down, you squeeze the fluid down and let the air out of the vial come up.